A lot of people don't realise that there's a strong correlation between smoking and mental illness. In fact, 1/3 of all the cigarettes sold in Australia is to a person with a mental illness or a substance use disorder.
We know that people with enduring mental illness have very high rates of smoking, but what we didn't know until very recently was that even young people presenting for the first time to first episode psychosis services have very high rates of smoking as well. 59% of young people are smoking by the time they come to us for the first time.
People with mental illness smoke at an earlier age and actually end up being more dependent on cigarettes. They actually inhale more deeply and they hold their breath. They might not realise they're doing this, but because of this they become more dependent on the cigarettes.
Not only are there such high rates of smoking in young people when they come to us, but they've already been smoking for up to 5 years before they've come to our services. So that's very different to their same aged peers who, it's a 6 times higher rate of smoking than people who don't have psychosis.
If you're more dependent on cigarettes, it's harder to quit and you actually get more of the harmful effects from smoking.
We have recently learnt from very large, reputable studies that there is an increased risk of psychosis in those who smoke tobacco. We've always known this, that there was an increased risk with those who smoke cannabis, but up until recently we thought that was the cannabis itself. Now the studies indicate that there's something about tobacco smoking itself that may increase people's risk of developing psychosis. That's another reason for us as mental health professionals to really address this early and try and stop young people from smoking.
Physical effects we might be really familiar with, problems like cancer and heart disease. In the long term that can lead to heart attacks and strokes. Also there's mental health effects. People who smoke are at a high risk of developing psychosis or depression. There are numerous reasons why people with mental illness smoke. You could break down the reasons into 3 big categories. There are physical reasons. For example, they start at an earlier age and become dependent on smoking or more dependent on smoking. There are psychological reasons. They're often smoking to mitigate or reduce, say, their mental health symptoms such as depression or anxiety. Having a mental illness is already a stigmatising state, and so you're more likely to drift towards other people who are also stigmatised, including people who smoke. Nicotine is one of the most addictive substances and it's very hard to quit smoking, and just as importantly, not to relapse back to smoking. But if you've got a mental illness, it's actually even more difficult, and they actually need on average 7 quit attempts before they can quit smoking.
Unfortunately, mental health clinicians don't currently ask much about smoking in the consumers that they work with. This is a really important aspect to tackle. If there is one thing that people can really make a difference for people's health is to encourage and support a person to actually quit smoking to therefore increase their life expectancy.
The majority of young people with mental illness, including psychosis, don't want to be smokers, but they don't know where to go to get help. And that's where health professionals play a critical role.
So unfortunately in early psychosis services we have a very high level of young people that do smoke, but it is not something that is routinely monitored at the moment in mental health care. And that is because our focus has primarily been on looking after mental health symptoms like hallucinations and delusions. Now, what we really need to bring into practice is that we are asking regularly about smoking and how often people are doing it, and how long they've been doing it for.
With assistance, including medication or counselling, you're much likely to give up smoking and stay off smoking in the future. If you do relapse, you can look at the reasons why you've relapsed and build that into your future quit attempts.
The first step in assessing someone's smoking is to take them through a very brief questionnaire that is called the Fagostrom. This tool gives you an idea of how addicted a person is to nicotine and can support further clinical decisions down the line.
There are a range of treatments that are available to help young people with mental illness quit smoking. There are 2 main types of treatment. There's medications and counselling, and it's much more effective when the 2 of them are combined together. The medications include nicotine replacement treatments and medications such as varenicline and bupropion.
In terms of medication interventions, nicotine replacement therapy is the most common sort of therapy used. I think one of the really important things to remember about nicotine replacement therapy, because many of the people with severe mental illness actually smoke at much heavier levels compared to the general population. So the NRT that is used for the general population is often inadequate for the consumers that we work with.
If a person's been on these before and have actually tolerated them and actually did quit, often it's better to go back to the treatments that have worked. If those treatments haven't worked, then you should actually try maybe the other treatments. Many practitioners are very worried about prescribing some of those treatments, and if that's the case, it's important that you get assistance.
So, in collaboration with smoking cessation experts in mental health from across Australia, the Mind Gardens Neuroscience Network have developed the tobacco treatment algorithm for people who access mental health services. This is designed to give clinicians the confidence to support people in quitting smoking, both through pharmacological and non-pharmacological avenues. It provides specific information around the medication that can be used to support people to quit smoking and NRT, and the specifics that apply to psychiatric medications as well, to make sure that clinicians are confident in what they're prescribing and can feel safe in the way they're supporting consumers to quit smoking or reduce their intake of tobacco.
We strongly recommend brief intervention counselling for consumers that are smoking. The reason for this is it actually keeps it on the agenda in terms of assisting someone to quit. And we find that it's not actually necessary to, every time you see someone, to do a half-hour session, but the power really is in speaking to someone regularly about that and about the goals they've set, even if it's just for 2 minutes.
To monitor a patient's progress through treatment, we commonly use a device called a smoke-ELISA. This looks a bit like an alcohol breathalyzer. It measures the carbon monoxide in exhaled air. And what we can do over time is track how patients are responding to treatment. So if they are responding to treatment, their carbon monoxide levels will drop. And that's great for reinforcing progress in treatment. Up to 80% of people with a mental illness smoke, and that's significantly higher than the general population, where only up to 15% smoke. People with mental illness are really motivated to actually quit smoking, but often have not been successful in the past and actually don't know where to turn to get help. As a health practitioner, you can provide young people with mental illness another good reason to quit smoking. Often when people on medications quit smoking, they need the doses of those medications reduced. And young people, when they hear that, often see that as a very positive reason to try to quit. Medications that are commonly affected are some of the antidepressants and some of the antipsychotics, medications like olanzapine. There are many reasons why young people might want to give up smoking. A common reason is that if they gave up smoking, they'll actually be giving themselves a pay rise. All that money that was spent on cigarettes could be spent on other things like clothes or music or going out with their friends. All mental health practitioners should be screening their patients on their smoking status. And if they are smoking, they should be either providing treatment that's individually tailored towards that person or referring them to a specialist service. The key take-home message is that smoking in young people with mental illness is very common, and really not enough has been done to address this major public health problem. As health practitioners, please screen and provide treatment. And if you can't do that, that's fine, but refer to a specialist service.